Let's start with the Middle East Respiratory Syndrome or MERS outbreak here in Korea. We go straight to our Kim Ji-yeon, who joins us at the news center. Ji-yeon, thanks for joining us. Can you give us the latest?
Well, Daniel, the central government announced that the MERS death toll had risen to 7 as of Tuesday evening, with the number of confirmed cases at 95. As a preventative measure, the government says it will examine all patients with pneumonia in 4 regions: the capital city of Seoul, Gyeonggi province, the city of Daejeon, and the city of Asan in Chungcheongnam, the province. It also plans to categorize all confirmed patients according to their conditions. Meanwhile, an official from Samsung Medical Center has confirmed that a pregnant woman whose due date is later this month and was receiving treatment there has contracted the MERS virus. The woman, who is in her 40s, is reportedly suffering from mild respiratory problems. We'll have more on this story as it develops. Daniel.
Well, there are rising concerns that MERS is spreading to other regions, as 2 people from Gangwon-do province and another one in Chungcheongbuk-do province were confirmed earlier today, Ji-yeon. At this point, is it really possible to see an end to all this in a week's time, as the government suggests?
Well, for the past few weeks, the government has been criticized for its belated response when the MERS outbreak began, mostly for not being able to contain and keep track of those who had contact with the first patient. But local experts seem to agree that the government is, to a certain point, going in the right direction by taking proactive steps to contain the virus's spread. On a daily basis, the central government, the health ministry, and municipal governments have been sharing critical information with the public about how they're handling the situation. Just earlier today, acting Prime Minister Daejeon set a new goal of trying to stop the virus's spread within the week and vowed to mobilize all necessary resources to combat the virus, including full coverage of all medical expenses for MERS patients.
There's a need to deal with the MERS outbreak at the serious level, the country's highest response level for infectious disease, instead of the current level of caution.
And with this information, the country is taking numerous steps toward containment. Right after the first MERS case was confirmed in Chungcheongbuk-do province, health authorities there shut down 2 medical centers and where the patient had been undergoing treatment there. And around 2,200 schools and preschools, which is more than 10% of schools nationwide, have closed temporarily to prevent an outbreak among students. And you can see, all in all, that the country is working together in this trying time, and the government's response is a big part of that. And I'm not the only one who shares this view. An investigative team from the World Health Organization, which arrived in the country earlier this week, says the government is handling the MERS outbreak well, and the team, comprised of 16 members in total, is expected to initiate its own research and infection control measures starting today. And they will announce the results of its comprehensive evaluation of the MERS situation in Korea on Saturday.
Okay, going down to the personal hygiene issues. As preventative measures, we've been told over and over again that washing our hands thoroughly, that's a no-brainer there. Anything else we have to keep in mind to prevent the spread of the virus, Ji-yeon?
In fact, well, the city of Daejeon is on alert after Ulji University Hospital confirmed a case of MERS in a patient who is currently in critical condition. The city is asking people who went to the hospital on the evening of May 6th to alert the health authorities, and you can do that by calling the MERS call center at 042120 or through the city's website there. And for the general public, meanwhile, the health ministry is asking people who don't require medical treatment at this time to refrain from visiting local hospitals and medical centers unless you're really sick. Back to you, Daniel.